You've suffered an injury in the emergency room and now you're wondering, how could this have happened? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a medical malpractice and childbirth injury attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about some really important information. And this information is going to deal with the two common ways that we see errors or injuries happen in the emergency room. The first one is a misdiagnosis. Yep, that's right, a misdiagnosis. The medical professionals, they misdiagnose a medical condition. How doctors generally go about getting to the right medical diagnosis is through what we call a differential diagnosis. What this means is that the patient will come in and talk with the doctor about their symptoms and how they're feeling. And the doctor will then take this information and either in their mind or on a checklist, they will go down and they will think about all of the medical conditions that can meet these symptoms. And the doctors will then order tests or they will do examinations to either confirm or rule out their diagnosis. That's what we call a differential diagnosis. Now, when a doctor is doing that, it is very important that the patient takes the time and be honest with the doctor. Give a truthful history with the doctor. Tell the doctor or the nurses what's really going on. This is not the time to be He-Man or Superman or Superwoman or Supergirl or whatever you want to call it. This is not the time to be that. You have to be truthful with the doctor because that's how the doctor can get to the right diagnosis. The second error that I want to talk with you today about is what we call a failure or a delay in diagnosis. And this can happen because for whatever reason, the emergency room staff, they do not meet the needs of the patient quick enough. Maybe the hospital, the emergency room is understaffed, or maybe there is a situation where a nurse or a triage personnel comes to a conclusion that this particular patient, their condition is not immediate. They don't need immediate help, when in reality they do. And that patient can either suffer a serious injury because of that delay in treatment, or that patient can die. So why have I taken the time today to talk with you about this important information? Because I'm trying to help you understand this process. I'm trying to give you insight into some of the things that your attorney is going to be looking at anytime we're dealing with an emergency room injury or an error that happened in the emergency room. If you have more questions about what happened to either you or a loved one in the emergency room, you suffered an injury and you think that it was because the doctors misdiagnosed the condition in the emergency room and the signs were clearly present as to what you were dealing with and the doctors missed it. If you have questions like this is what I invite you to do. Go ahead and pick up the phone and give me a call. It costs you absolutely nothing to call me. I can be reached at 301-850-4832, or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice and childbirth injury questions like yours all the time, and I will be glad to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the medical malpractice and childbirth injury attorneys here at Boston Law Group LLC, and we will see you next time. Take care and enjoy the rest of your day.